Yeah, I want to bring you some new method to access breast cancer diagnostic near. And as you know, most common cancer of women in the Western world is breast cancer, and the only chance to get that to a healthy, longer life for women is to detect the breast cancer earlier. That means at a size of smaller than 1 centimeter. And the only then and gold method is MRI until now, which has enough probability to detect really breast cancer. Mammography is in the range of 60 to 80%, but MRI is in the range of 80% or more to give a right diagnostic. And I want to show you that we have now a new method that means 3D ultrasound computer tomography that can do that to a low price. What is 3D USCT? The basic idea is to surround an object with unfocused ultrasound transducers in a fixed setup. That means in this image here the breast is suspended in a warm water bath as a coupling medium to about 2,000 transducers. And but what is the diagnostic value? You get reproducible 3D images and with 3 modalities. Reflection, that means high quality B scans, and speed of sound and attenuation. That means especially in physical quantities that is different than the other methods. You see really for each voxels of the image the speed of sound and attenuation, and that is specific for the different tissue types which you have in the breast. That is the old idea of green leaf, where you have here the sound of speed against the attenuation, and here fatty tissue is in this region, and glandular tissue here, and other tissue types like cancer lies at higher sound speeds and attenuation, but also the skin has a higher sound speed. How does it work? You have this vessel which contains at the surface all the transducers, and you select one emitter, and all other transducers are hearing, and you gather all the pressure over time. That means A scan, and you see here in the direct path to the receiver, you see the transmission pulse, which gives you the time of transmission and the amplitude, and you have also the scattering, which comes later, that is and the reflection tomography. By this method we get about 10 million A scans. We can move a little bit also the overall vessel, up to 40 gigabyte of data per breast, and have a measuring time between 10 seconds and 4 minutes. That depends how many movements of aperture we do. And that means the acquired information is a voxel picture of the sound speed, attenuation, and reflection. The reflection is corrected in our reconstruction also by the sound speed, that you have a very clear, good resolution. We do with this device a clinical study in the years 2012 and 2014 to prove really the clinical setting, and compared with the gold standard MRI as ground truth. we had only a few patients, 10, all with suspicious lesions, implants, cancers, papilloma, fibroadenoma, and so on. And look how good we are. Here is an example of a healthy woman, and you see here the ligature structure in the MRI. All the time, the next picture show only the upper line, the MRI images, and here our UCT. And you see here also the structure, and if you enlarge that, you see here the same structure in both images. And that means reflection gives you also a good access to the structure inside. But if you add also the speed of sound and attenuation, and here we have the sound speed for this breast with a relatively large cancer, which you can see here in the registered MRI, and with contrast enhancement, that means you have there to imply a contrast agent. Here, only by looking for the speed of sound, you see at the same positions the cancer by the very high speed of sound. Here, here, here. And that means you need no further information to detect the cancer. Here's another example for a multicenter carcinoma that is very difficult to identify in mammography, where you often don't see it. And here you see it only by the speed of sound, but you see also the skin. There's something also high speed of sound that is natural because that depends a little bit of a patient, but really skin has in the same range speed of sounds. That means it's a third example, and then you want to see how good is multimodal imaging and classification was Greenleaf right, and here we have some data from the Kamenos Cancer Institute in Detroit, where we work also together, and you see the mammogram and the segmented mammogram with the fatty tissue and compared to the speed of sound. And when you see again here the cancer, and when you try to classify by the speed of sound and attenuation the different tissue types, you mark then some regions and look what you get out, and by the speed of sound, and that is here on the right side. You see here fatty tissue, glandular and tumor tissue here really is in this map separated, and that is clearer if I put the picture back, and that gives you a good idea how this method works, and that was some of the first results. And here is also an example for this one of these breast mammogram, fatty tissue by speed of sound, glandular tissue, also speed of sound, and then the cancer. And that is really the strength of a method against all others. Our method is the only 3D system in the world, and we are now looking for a further clinical study, and that is done now at Mannheim, Heidelberg, in the Institute of Professor Schönberg, with 200 patients, and we construct now a system which has a higher resolution in the position of the speed of sound and the speed of sound itself, and especially also attenuation, that we have a comparable resolution. That means below the wavelength, half a wavelength roughly in the breast. And we use 2.5 megahertz for ultrasound, that has a wavelength of 0.6 millimeter, and for reflection tomography we have a resolution of 0.25 millimeter resolution, and we have now the first glimpse of some reconstruction that we can get the same for speed of sound and attenuation. That means the vision which we have is that 3D UCT is as harmless as diagnostic ultrasound in a normal sense, because you have no X-ray, but is affordable as X-ray, is not in the range of MRI in the price, and as good as MRI. Thank you very much. But one example, let's see, that you see that really it is 3D, and you look in the breast really, and it's continuous because you have an open aperture. You don't have difference in the resolution. You have no slides at all, and that gives you really some 3D imaging through the breast, and you can then see where in the breast you have really the cancer, and that is the nice thing at all. Thank you very much.